Good morning. Welcome to the classes. Today I will be showing the demo session for Pharmaceutics first unit, that is dosage forms, introduction to dosage forms. So before coming to this session, we have to understand two major things in this class, that is what is a drug and what is a dosage form. So here it is given, drug is an agent which is intended to use in the diagnosis, mitigation, treatment, cure or prevention of disease in man or in animals. So here mitigation means to reduce, then for the treatment, then for the cure and prevention. For these particular things we can use the drug as an agent. So that means the drug is working on the different aspects of a treatment procedure. Okay, it is be using for the diagnosis purpose, the mitigation purpose. Mitigation means to reduce the effects. For example, to reduce the effects of a condition, that is pain. If we have a large amount of pain in the body, we will try to do the mitigation process. That means to reduce the effects of pain through a drug. Then for the treatment purposes, for cure and for the prevention of disease in man or in animals. And the second point, the drugs rarely used in pure state. So as it is we don't use the drugs in the pure state, we will go to add the non-drug component to it. They are known as additives. So when the drug is mixed with the non-drug component, we can make different dosage forms, or we can make up as a suitable formulation. Why we adding these additives to the pure state? Which means these additives gives the drug a particular shape, increase the stability of the drug, palatability and a well elegant look to the drug. So this is the first part of an introduction. So now we can move to the second part of it. As I said, the dosage forms is the combination of drug and the non-drug components together. So now we can understand what is the importance of dosage forms. That means the reason behind it. So there are certain points that shows why it is important to make different dosage forms instead of drugs we use in a pure state. So the first is to provide safe and convenient delivery of accurate dosage. Without accurate dosage forms, there is no proper treatment we can give for the patients. And as it should be safe and convenient. Most of the time the drugs will be in the pure state. There are chances of so much impurities which is present in the drugs. So which is not safe for the patients to take the drug in such a way. So we have to mix it with certain non-drug components to make the drugs which is usable for every patient. So that is the point here we are reasoning. The second point is to protect. To protect the drug from oxidation, hydrolysis, reduction and from the gastric juices after we intake the drugs. So as the drugs is in the pure state, there is the chances of certain chemical reactions. They are oxidation, hydrolysis process, reduction and gastric juice. So to keep the drugs safe and effective through all these processes, we need coated tablets. To make the tablets in a coated form, we need the non-drug components with the drug. Then the third point is to conceal. To conceal means to avoid or mask the bitterness of the pure state of the drug, or maybe it's in the salty form, or in the obnoxious. Obnoxious means unfavorable or maybe very pungent smell, taste or odor of drug substance. So for in the pediatric patients or in small kids, we will provide flavored syrup for the kids. Why? Because the drugs in its original state will be very unfavorable taste or odor. So we add the additives to these syrups. Then the fourth point is insertion of the drug in the body cavities needs specific formulation. Now the drug we are inserting in the body. So what happens when we insert in the body cavities? A specific formulation is needed because it is not easy as giving the drug in the oral form. We need a specific formulation. To make a specific formulation of the pure state of a drug, we need the non-drug components. For example, these formulations are rectal and vaginal suppositories. We will learn more about the rectal and vaginal suppositories in the coming classes. So, these are the... And the next point is to provide optimum drug action. That is, optimum here means maximum or required amount of drug action through inhalation. So when we have a proper amount of drug in a certain dosage form, we can reach the optimum level. Okay, so certain drugs are used for the inhalation purposes. They are known as inhalants. They are used in asthma and chronic obstructive pulmonary disease patients. Then comes to provide maximum drug action for topical administration sites. Here it is inhalation. Here it is used in topical administration. Topical administration means that the drug is used on the skin. For example, they are the creams, ointments. Then the seventh point is to provide liquid dosage form of drug soluble in suitable vehicle. So liquid form of drugs, that are the solutions. The solutions will be in a liquid form. Okay, to maintain it or to maintain the stability of that liquid dosage form, you have to add a suitable vehicle to it. By addition of the suitable vehicle, we will get a perfect solution. So that is the seventh point of the usages of the dosage forms. Then comes the main point, that is the classification of dosage forms. Then comes the dosage forms. The dosage forms we can classify into three main categories. One is solid dosage form, liquid dosage form, and then comes the semi-solid dosage form. Again, it is classified into many other forms. In solid dosage form, we can classify into again two, that is unit dosage form and bulk dosage form. Okay.